Hello, and welcome to MindTrack. Next slide. Our company is comprised of the 5 of us. My name is Lucia, and this is Jasmine, Devin, Jackie, and Daphne. On the next slide, I will discuss how our presentation will be split into 5 components. I will begin with the background of our innovation goal. I will introduce our company, our product, and the goal of our innovation. Then we will go into our innovations design and the materials used, as well as the components and functions of MindTrack. Third, we will discuss our innovation operations and the committees, partners, and testing of our innovation. Fourth, we will discuss MindTrack's funding plan. And lastly, we will provide a summary of our innovation. Now let's get started. Our company is called MindTrack. Our mission statement is to provide top-of-the-line products that will enhance the quality of care and maximize the support for not only the patients affected by Alzheimer's disease, but everyone involved, such as the caretakers and families as well. Next. The foundation for what our company is all about is to enhance support for all affected. We want to make sure we are providing the best products to service your needs in order to provide enhanced care and comfortability for all affected by Alzheimer's disease. Now I'll go into the background of our innovations goal. Next slide. One of the most important health issues in today's society is the progression of Alzheimer's disease. In 2019, 5.8 million Americans are currently living with Alzheimer's disease. 5.3 million of these Americans are over the age of 65 with little to no help for an independent lifestyle. Our solution is our MindTrack bracelet and surveillance system. According to the Alzheimer's Association, and as you can see in this graph, it is predicted that by 2050, 13.8 million will be affected by Alzheimer's disease. This is why we created MindTrack, to help improve the quality of life and support for the growing population that will be affected by this terrible disease, as well as support for the caregivers and families of these people. Next slide. Our competitors are more focused on stay-at-home nursing, medication for patients, and even assisted living for those affected by Alzheimer's disease. However, all these possible solutions can be quite expensive. They can cause depression in the patient, and it can also minimize the patient's independence to almost zero. Not to mention, medication can have some serious side effects on the quality of life of a patient and can cause dizziness, nausea, and increased blood pressure, just to name a few. Next. Therefore, while others are creating expensive products and medications that focus only on the patient, we at MindTrack are providing comfortability, safety, and reduced anxiety for all affected by Alzheimer's. We'll also increase the independent lifestyle that those affected by Alzheimer's crave to keep with our MindTrack bracelet and surveillance system. And now I'll pass it on to Jasmine to discuss our innovation design.
All right, thank you, Lucia. So before we go into the innovation design, I'm going to take a moment to emphasize the pain points that our innovation addresses. So the first pain point is the fact that middle to late stage Alzheimer's patients tend to hurt themselves because of safety hazards that are made unaware by the caregiver. For example, leaving the stove on or putting aluminum foil covered food in the microwave and then forgetting to come back to those tasks. The second pain point is that caregivers of Alzheimer's patients face financial burdens because of the high cost of medical alert devices. That includes having the caregiver pay for additional subscriptions or fees in order to utilize a medical alert device's services. The last pain point is the fact that Medicare and Medi-Cal do not cover enhanced medical alert devices, and the patients would have to pay out of pocket just to use an enhanced medical device. So this next slide shows the differences in the functions and health coverage of enhanced medical alert devices and regular medical alert devices. So to start off, MindTrack is not a single product, but a medical alert device kit that includes the necessities that both the caregiver and patient need at the moderate stages of Alzheimer's. A bracelet with Bluetooth connection, 2 security cameras that also include Bluetooth connection, as well as an app that helps the caregiver to monitor the patient. Design A is meant to be placed on the ceiling, while Design B is meant to be placed on a tabletop or counter of an area where the patient frequents. In reality, having a device to track the location and well-being of the patient requires buying 2 separate devices, which tends to be costly. Compared to our competitors, the average cost of a smartwatch and security camera combined would be around $188, whereas our innovation would be an estimated cost of $30 to $40. Along with the high cost of the separate components, these devices fail to address all the pain points of Alzheimer's patients that our group has emphasized, specifically with the financial burden that these devices cause for caregivers and patients through additional subscriptions, which applies to the example products that I stated before. Thus, MindTrack's estimated one-time cost will be 1/6 of the total cost of purchasing these same components in order to relieve the financial burden of caretakers who want the best for their patient. The mobile application will be free to download, but only functionable if MindTrack is purchased and activated. So moving on to the detailed functions. Here are the specific main functions of each component of MindTrack. For the bracelet, it has a built-in GPS sensor, a sensor for the bracelet's heart rate monitor, a voicemail or call function similar to that of Zoom, Bluetooth connection to the phone and camera, and a 2.5 by 2-inch waterproof touchscreen with user-friendly icons to help the patient to simply navigate the bracelet. For the cameras, each camera can be placed on a countertop or ceiling, help the caregiver to visually monitor for safety hazards, include pan and zoom functions to look at the environment closely, have a Bluetooth connection between the bracelet as well as the phone, and the design of the lenses is meant to provide a wide view of the room or area where the patient is, similar to that of our vision. As for the mobile app, there's a map that the caregiver can view that connects to the bracelet's GPS sensor, a heart rate monitor that is connected to the bracelet's heart rate sensor, voicemail and call functions, a camera view function where the caregiver is able to set an interval alarm to monitor an unstable Alzheimer's patient, as well as the ability to download the application for free to use after the camera and bracelet are purchased and enabled. Now, I'll pass it on to Jackie, who will go over how our innovation will be operated.
Thanks. So in order to place MindTrack services into the market, there must be multiple committees developed, and each will have experienced members to help bring this convenient product to life. Next slide. So some of these committees consist of developers, practitioners, manufacturers, financing groups, distribution groups, and as well as analytic groups. Next slide. So there are three major phases within our product. And the first is the programmers, which consist of programmers, practitioners, and psychologists. They need to have firsthand experience and knowledge about this disease and the needs of the patients. The group will then be formed around July 2020, and the programmers will create a convenient and simple design. This process would be completed around December of 2020. The second phase is the development phase, in which partners with financing groups will have manufacturer companies that have experience with creating surveillance cameras or tracking devices. The final prototypes will be out within the following year in 2021. The third phase is the public launch, which consists of the sales and distribution groups. After making improvements, it would be time to offer it to the general public. We will continue to advertise and make our presence known, and we want to make this process simple for big companies and as well as individuals to have access to our services. Product receivers can agree to provide feedback about the design, and analytic groups will collect this data and about how consumers feel about the product, as well as any app crashes or any bugs. It'll help us create improved versions of each product. Next slide. So before the 2023 public launch, I wanted to go over the types of advertising that we would want to include. We want to create a public or an online presence with advertisements on television as well. Early investors, interested customers, or assisted living facilities may receive PR boxes from us, and they can help test out each product for free in exchange for feedback and opinions. Holding demos at community awareness events will also help for exposure too. Next slide. So within the development phase, we would be assisted with the pilot program. This program will hold around 100,000 clients, and it would run for about half a year. Afterwards, we would bring in the same participants for a post-program interview that include yes or no questions as well as open-ended questions. In this time, we will take all the opinions, concerns, and feedback into future improvements. The product will be available to over 2 million Alzheimer's patients and their loved ones. Next, Daphne will go over the funding needed.
Thank you, Jackie. I'm Daphne, and I will be discussing the topic of funding. Next. Yes, we are asking for $1 million, and that is a lot of money, but all the funding will be properly allocated in the following few slides. We want to demonstrate that funding for our project is an investment for yourself, investment to well-being, and the new future. Next. We predict growth of our company will be based on 4 focuses: affordability, partnership, prevention, and innovation. Affordability, as my partner Jasmine mentioned before, we focus on reducing the cost of our product, reducing the financial burden to our potential clients, and expanding the options available compared to resorting to nursing homes, which can annually average around $80,000 in California. Partnership, our next focus. We strive to do better, not just a product, but a lasting brand to be reliable. We will work hand in hand with professional providers and receive customer feedback through intervention programs on a biannual basis. Prevention, thirdly, as safety is our goal. The safety of our clients and satisfaction of a well-made product can reduce the struggles of morbidity. Lastly, innovation. Our product concentrates on the autonomy of a person with Alzheimer's, giving them a chance to prolong their quality of life and reduce stress-related factors for the caregiver. Next. We will partner with physicians to back up our research with science and data. Insurance companies will subsidize costs, and eventually the government to reach a wider crowd. Next. Now let's look at how we allocate our funds. Approximately $30,000 will be allocated to the production, as an average cost of each product is about $30 to $40 to produce. App development around $5,000 to $10,000. Filing for a patent around $1,500 to $2,000, then covering all the costs of filing a patent throughout the several years, and supporting the cost of having a lawyer. Creating pilot programs such as interventions to receive active feedback of our products will be conducted through trials and surveys to work out glitches and perfect our product. Finally, labor costs to bring everything together, to pay for our team of engineers, marketers, financial analysts, data analysts, and more, as the people in this company create MindTrack. Next. We're an ambitious company. It is true we are a California Silicon Valley-based company. However, U.S. is an aging population. Approximately 70% chance clients 65 years or older will seek long-term care. And we want to reduce the need for nursing homes and expand mobility, autonomy, and the well-being to all over the U.S. and eventually market our brand globally. Now, I want to pass it along to Devin, who will conclude our proposal.
So I will be concluding our presentation. Next slide, please. And so in summation, there's great consideration in creating the viable final product with your help. And so we are using eco-friendly materials so that we save the earth and help others who have Alzheimer's and their caretakers. We have conducted a multitude of trials to assure quality, and we have assured that it has been user-friendly, and 97% of our volunteers enjoyed the easy interface. Next slide, please. And so some of our key points is that our MindTrack device is designed purposefully and only applied for people who are taking care of Alzheimer's patients and themselves. The app will ease our stress and the stress of people who take care of the Alzheimer's patients. Is tested and proven, and we are pioneering the Alzheimer care and we are leading the industry because of this. And so will you take the next step? Will you mind the progression to come? Will you track the growth? And are you ready to MindTrack with us, investors? And so thank you for your time, and thank you for listening to us, and thank you for your consideration. And as I conclude our presentation, I'm going to leave you with the quote by the Science Daily. The tendency of people with dementia to wander and become lost has led researchers to recommend a silver alert system similar to Amber Alert systems for missing children. And so this is the foundation of all that we do for MindTrack, and we hope that we have convinced you to earn your trust and your support. Thank you. from all of us at MindTrack.